Well, under Obamacare, states had the option to set up their own insurance exchanges and to expand Medicaid for the poor. But many red states where Republicans dominate chose not to. Tonight, Wyatt Andrews tells us about one exception, Kentucky.
It works, and it's working well.
He's the Democratic governor in mostly Republican Kentucky, but Steve Beshear took a political risk and fully embraced Obamacare. He had the state build its own healthcare exchange, which at 60,000 enrollees is among the nation's most successful. Then he expanded the state's Medicaid program by executive order, which bypassed Republican opponents in the legislature.
Why did you do that?
Very simple, Wyatt. It was the right thing to do. Kentucky has had horrible health statistics since they started keeping health statistics.
Kentucky has some of the country's highest rates of smoking, cancer deaths, and heart attacks, and the governor argues that expanding insurance gives more people access to doctors. 48,000 residents have already enrolled in Medicaid, including Carter Tate, who lost his private insurance last year.
Just relieved a whole lot of stress for me, so I'm very thankful for this.
Thank you very much.
Very thankful.
But Beshear also tied Obamacare to the economy. Two independent studies concluded that Medicaid expansion, thanks to 100% federal funding, would generate billions in income and 17,000 jobs related to health care.
Well, when you put those economic facts together with being the morally right thing to do for your people, it's a no-brainer.
When you say morally right thing to do, what do you mean?
You know, our people deserve this. They deserve to be healthy.
Republicans applaud the governor's intentions but question his math. Over time, the federal share of Medicaid drops from 100% to 90%, and the state's 10% share could cost hundreds of millions. Republican Robert Stivers is president of the Kentucky Senate.
It is big money. That is a large portion of our state budget that we will be placing into that system.
12,000 Kentucky residents have also signed up for private health insurance, and a high number of them, 41%, are age 35 and younger, which is the age group needed to finance the system. Margaret, one advantage to having a website that works is more appeal to younger people.
Wyatt Andrews in Washington.